Amid political distrust and social injustices, the delayed response to the coronavirus's emergence allowed for hundreds of thousands of lives to be lost. In the space of emerging remote and hybrid work environments, employers are now tasked with facilitating the response to a public health disaster. In this presentation, I will be exploring the trends within remote work environments, as well as their emerging impact on occupational health and wellness programs for employees. While remote work has seemingly less ethical risk in its well-meaning flexibility, working from home or otherwise can carry two sides of the coin to consider for both workers and employees. The new thoughts, feelings, perceived obligatory efforts, and expectations for both organizations and their individual staff members must be taken into account when developing measures secondary to factors we cannot control, like the pandemic or needing time away from work. Supporting the primary stakeholders of organizations with positive and transparent communication supports ethical principles while simply just making sense. It accounts for new barriers in the lives of employees while working to develop policies that are still ethical and equitable. This can positively impact the mental health and long-term productivity of people at the organization and ultimately the organization as a whole. Without the needed reciprocation and necessary transparency between employers and their staff, the epidemiological triangle is disrupted as the primary stakeholders are discounted and excluded from decision-making. Having unethical principles like a lack of transparency in hybrid work environments or lack of willingness to develop or recognize that there are programs that help employees or can lead to the introduction of supporting the environments and shaping post-pandemic relationships. Now let's step back for a moment and think about this. When the pandemic emerged and remote work came with it, communities and workspaces had to be rearranged. As much of the lives of people already revolve around work, they became more intensely so as the home and work office became one. A recent qualitative study found that over half of workers self-reported their activities decreasing by an average of 60% since working remotely. This survey, like many others, captures the drastic dip that well-being takes when our mental health is excluded. Coaching opportunities were reportedly decreased in the workplace, understandably so, when the pandemic emerged. Workers facing productivity upon which their survival depends, coping with loneliness while also seeking out and maintaining functional relationships and support at work, establishing some semblance of a long-term career. This is what we all strive towards, but the pandemic has clearly made this much harder, and recognizing these external barriers can have perceived productivity or perceived means of control increases with employees. In ignoring the barriers that prevent us from performing at our best, organizations are truly discounting their own values as well as the continuity that endorses and supports the longevity and happiness of employees. Though initial progress is centered upon the clinical response, this can result in several system downfalls down the line. The lack of prevention and programs invested in areas of change had set the scene for survival of many to be dependent upon their income and employment status. In comparing the productivity of those working from home with children than without, as employees with children at home work almost 1/3 of an hour more per working day than those without children. In a post-pandemic virtual setting, those without children still work 1.4 hours more per day per hour than those in a regular work setting. Individuals within these categories have been also seen to have higher job turnover rates and rates of dissatisfaction. The thought of having to pay out of pocket for the coronavirus is frightening to many, as their employer-based health insurance is their only barrier from facing detrimental financial costs. For about half of Americans receive health coverage from their employers. With record numbers filing for unemployment insurance, millions find themselves without health insurance in the midst of the largest pandemic in a century. Even those who maintained health care coverage may find care unaffordable and choose not to seek it. The idea that human behavior is modified by self-interest is as prominent as it always has been, with healthcare being more of a business in the eyes of patients depending on their financial statuses, and the decision of whether to seek care is ultimately decided by their ability to pay. In the eyes of mental health, this can mean completely forgetting about essential visits or different coverage that we can offer our employees to relieve stress or anxiety. On a day-to-day level, this can also impact the interpersonal relationships with employees. This is more than just our one-on-one meetings, but can also be coaching opportunities, small conversations, and times to connect beyond work. For many organizations, remote work may have been the safe option in terms of the COVID-19 crisis. It has seemingly less ethical risk, like invasion of privacy, the accessibility of work, and well-meaning flexibility.
But money isn't everything.
And in the context of barriers, the COVID-19 crisis brought forth internet inequities like access and different health insurance policies that didn't suit others. Organizations were found to save an average of $1.68 per employee per hour on a day after the COVID-19 crisis began. Working remotely in comparison to in the office has different supply needs that are no longer required, like electricity, rent, and of course on an individual level, commuting every day. Offering different benefits to compensate, however, for the lack of physical exercise include different health club memberships or expectations for employers to have salary increases. With the COVID-19 epidemic and pandemic came a increased anti-work movement, as well as an expectation for employers to work differently or not at all. This has been a slogan that is very empowering for workers, but is also, just as it sounds like, a ultimatum for employers to get their acts together, offering new benefits and looking at their feasibility in terms of recruiting a new employee versus negotiating and satisfying the needs of our current employee basis in order to meet the current supply or demand of their consumer basis. So this is beyond working differently or not at all, but also our interpersonal relationships with employees, and what does that look like in combination with our different benefit programs and ways that we can support our employees, like employee assistance programs and the ones listed here. Moving into the future with the experiences and perspectives that the pandemic has given us, the weight of the healthcare system has shifted the expectations of what people are entitled to receiving. With the continuance of innovation and new medical technologies emerging, the focus and the strive of healthcare continues. Our expectations for employees and their expectations for us have developed into what we should be proud of. However, it has continuously caused inequity for our employees. For this reason, benefits that we offer our employees have to be good, or they will leave. Studies have shown this to be true, and unemployment doesn't lie. Most times, developing our own work environments and work habits is creating the most ideal environment for ourselves. By encouraging buffer or scheduled work tasks, we are pushing our employees in the direction that we want to see our organization go by having them improve their own habits and efficiency levels. And allowing them to spend time with family and encouraging PTO use can also reduce burnout and ultimately push employees and the organization forward. The benefits that we offer our employees don't just have to be in the form of reimbursement plans for health or gym memberships. They can also be interpersonal relationships or related to the habits that we build into our employees' days. It's also important to note that the barriers that employees experience will be different and vary between each employee and individual. While the pandemic has had intense and restraining factors against us, it's also very important to note that people will cope with these changes differently and may not be comfortable with hopping right back into the office or incorporating video calls into their daily routines. Support methods will vary from person to person, and this is normal. If a person says that they might do better without a support method, that's okay too. Just recognizing that it's available and identifying what works best is a good place to start. Transparency in the workplace can support safe practices, productivity, and solidarity in the face of a global health crisis, while also lending to a sense of autonomy for workers as opportunities to communicate boundaries arise. While studies show that incorporating remote work is helpful to improving productivity and general burnout in the office, it can also have its improvements. Virtual environments have largely streamlined communication between organizations' primary stakeholders, and ultimately we want a better, healthier workplace because the amount of time that we spend at work every week should not be a torturous process, especially through the pandemic and how much at home has become a reflection of the workplace, it's very important to both separate the two and create individual environments that suit the people at those organizations.